I would say is just the basics and the fundamentals of what do we actually have in our environments, in our organizations, like hospitals, for instance. Just having that asset visibility from a biomedical device is sort of a recurring problem in multiple organizations within the healthcare space. I think that is a great starting point.
And when these devices were first being designed, a lot of the manufacturers decided to cut corners. And they just used off-the-shelf operating systems. There really are devices out there. I don't think there's any left on Windows NT anymore, but there are a couple on Windows 95. There's a lot of them on Windows 7. But so they just use that off-the-shelf software because it was quicker. But then, like I said, these devices get locked down, so we're not able to patch them. And to a certain extent, vendors have gone, oh, sorry, we patch it if we can, but we can't because then we have to get it reapproved by the CDC, etc. And they're not wrong.
But a biomedical device that now has a SaaS attached to it that allows a physician to view a monitor in their office so that they don't necessarily have to go bedside to go look at the monitor to get the reports, etc. Sounds great. It's going to save physician a number of time, effort, etc. But healthcare, yes, there are certain laws and regulations and requirements, at least from a Canadian or Ontario perspective. So there is progress being made, but we are miles behind, I would say.
Hi, everyone, and thank you for joining us today. I'm Dinushka Balasingam. I am a security specialist within the healthcare sector, and some of my main roles right now include vulnerability management, incident and threat response. And I didn't initially start here. I actually started in health. Got more interested in computer science, and then I found myself at our technical operations center, and I got involved in vulnerability management through patch, which led me here to the cybersecurity team. And I'm excited to talk with you all today. So I'll just hand it off to Penny, our Director of Information Security at Kyndryl. And we also have here Momna, Farooq, the GRC Analyst at Scarborough Health Network.
So I'm a little bit about myself. So I'm actually Director of Security Assurance Services. I know it's a mouthful at Kyndryl. And I've been in cybersecurity for quite a few years. Sort of got into it from IT, and then have sort of a whole previous career in an unrelated role. But I headed up the cybersecurity at Fraser Health for 3.5 years, which is sort of where I learned more than I want to know about the cybersecurity of biomed devices. So, Momna, I'll pass it over to you to introduce yourself.
Absolutely. Thank you, everyone, for joining us today. Really looking forward to this discussion. My name's Momna. I work at Scarborough Health Network as a senior GRC analyst, so governance, risk, and compliance. Previously to that, I have experience in cybersecurity, in telecommunications, as well as managed services and consulting. And in a previous career, I actually did study healthcare radiation therapy. So my life has sort of come full circle a little bit, where I've been able to combine my healthcare experience and cybersecurity experience. So I'm really glad to be on this discussion today, and looking forward to chatting about biomedical devices and how to secure them. I'll hand it back over to Penny to kick us off.
Yeah, thanks. So what we're going to talk about today is particularly around the cybersecurity on biomedical devices, and a little bit of a background. You know, biomedical devices are devices that are either directly interacting with a patient or monitoring something about a patient, and they're different they're a specific kind of IoT, because they are, and other devices can cause a problem, but the biomed devices, if can actually directly cause harm to a patient. So they've been around for a long time. There's a number of issues with them, particularly around the fact that they were all built with they last forever, which isn't a good thing in a way, but the bad thing is that they're all built with software which is supremely insecure but unable to be patched. You're not, in most cases, because most of these devices have to be Health Canada approved, you can't patch them. So in the end, we have all these devices that we're not able to patch them. They default passwords or passwords you can't change, like all. If you can think of anything that you're not supposed to do in security, it's probably there's a biomed device that's done all of them. So, and they're becoming a real concern. Well, they've been a real concern for a long time. And there's a lot of things which we might have a chance to talk about that is being done to make sure that all new devices don't have these same pitfalls. But at the moment, we're still kind of in that place with these biomed devices. We're not able to protect them. We're not able to remediate the risks, as in patching the device or changing the password. So we have to go to all these other ways to mitigate the risk by, that's one of the things that we're going to talk about is what. So Momna, what are some of the things that is happening that organizations are doing to protect these devices that we urgently need, but which are sitting ducks from a cybersecurity perspective?
Absolutely, I can jump into that. So the biggest challenge, I would say, is just the basics and the fundamentals of what do we actually have in our environments, in our organizations, like hospitals, for instance. Just having that asset visibility from a biomedical device is sort of a recurring problem in multiple organizations within the healthcare space. I think that is a great starting point. Just ensuring what we have, and that we know what we have, and how is it interacting with our other applications, our environment, how is it set up? You touched on that these are very old devices, or that they last a long time. So just trying to understand how they were initially set up, and finding ways to update some of the structures around it would be a great starting point. So thinking about, isolating networks and whatnot would be a great starting point. I know we're going to deep dive a little bit more, but I would start with just figuring out what we actually have to begin with.
Okay. And Dinushka, you've got, what's your thoughts on this?
So I completely agree. And I do think, especially with what Momna was saying, it's good to know what we have in our organization, what assets are there. So one method that we can do that is with asset inventory, and real-time monitoring, I feel, is very useful, right? Because we can have a look and constantly monitor what devices are doing what activity they're taking, who might be using these devices. And with real-time monitoring, we can also have threat detection. So we can figure out and detect alert on unexpected behavior. And the way that these tools can do this is by checking for known suspicious behavior or suspected malicious behavior. So I think that's something that we could really use and would be very useful for not only knowing what we have in the organization, but how it's being used on a regular basis as well. And this would help us to act on any threats that we see incoming. The tools themselves can also prevent activity too. And in the case of false positives, we can inform the tool that, hey, this is actually expected activity from this device. With these specific users, can we no longer alert for these specific instances? But I think it's very useful, especially for the healthcare sector, to have these tools that can not necessarily take away our responsibility, but can assist us in doing our jobs better, and detecting where we need to like work on and giving us our time to put our efforts elsewhere.
Yeah, because I guess, up until now, most of the time, like I said, most of the time, healthcare organizations are in mitigation mode. They're putting them in segmented networks, or trying to lock them down as much as possible. Which is one way of dealing with it. But if we can, monitor them a little bit better and be able to react to these threats rather than just, putting them in a room, because there's problems with that too, right? So I think that's something that but again, that goes back to Momna's comment around visibility, right? You have to know what's out there. I know at Fraser Health, when we put in a system to do biomed monitoring, they found all kinds of stuff. I've spoken about this before, so I'm not any secrets. There was a Tesla connected to our corporate network, right? So that's the kind of, and they found devices in closets and different places that they sort of didn't know were there. So one of the things that I touched on was just around the fact that these devices. So what happened was way back when these devices were first being designed, a lot of the manufacturers decided to cut corners. And they just used off-the-shelf operating systems. Like, there really are devices out there. I don't think there's any left on Windows NT anymore, but there are a couple on Windows. There's 95. There's a lot of them on Windows 7. But so they just used that off-the-shelf software because it was quicker. But then, like I said, these devices get locked down, so we're not able to patch them. And to a certain extent, vendors have kind of gone, oh, sorry, we patch it if we can, but we can't, because then we have to get it reapproved by the CDC, et cetera. And they're not wrong, but there are ways to kind of manage some of these things better. Momna, talking about that, the vendor side of things, the vendor risk. I mean, vendor risk in general is big, and a lot of the stuff that's come out in the States around IoT and biomedical devices has been around managing that third-party risk. I think that's something that you're kind of actively involved in. Do you want to comment a bit on that?
Absolutely. So vendor risk assessments and vendor risk management from a security perspective in healthcare is already very much in the beginning stages, I would say, at least in the Canadian healthcare environment. The US may be doing it a little bit better, but I think there's just having the fundamentals down, that we have security involved in the procurement process right from the get-go, so that we are providing those security requirements before those devices even reach the hospital itself. Because oftentimes you get we've already purchased these multi-million-dollar devices and we've got to go live because patients are depending on it, clinics are depending on it, etc. So it's better to shift that whole discussion left, so that we're involved from a security perspective and providing those guidances. So when there are limitations, like we talked about, certain controls like these legacy systems that have passwords that are default passwords. Now, security best practices tell us that we're supposed to change that, but some of these devices don't allow for that. So there's only so much segmentation and, isolating these devices that you can do, because then it comes to that whole cost versus benefit discussion as well. So there's a number of things that security can certainly advise on. Oftentimes what happens is IT is told to just make these go live, create the environment, set it up, etc. And security is sort of like, oh, we needed that approval. So just shifting some of those discussions and involving us is a great starting point. The other way that we can improve things would be to influence a little bit on figuring out what is vendor managed versus hospital staff managed as well, because that's often a discussion of, well, the vendor is this big big shot in the industry. I don't want to necessarily use names, but there are just a number of very few vendors out there, right, with medical devices. So it's just we often feel from a hospital standpoint that, oh, well, they're the experts, they should be managing. I was like, hold on, no, we're the customer here. We can certainly exercise our rights and our requirements right from the get-go, and then throughout that journey. So we can certainly influence when patching is to be done. It's not a nice to have, it's a must have. We cannot proceed. Having contracts and security schedules in place as part of your terms and services agreements with these vendors of security requirements, of incident response requirements, breach notifications, etc. So that's another area that you can certainly exercise some of those rights. The other one is just educating on the clinical side. I think we can do really well in expanding on and just raising awareness essentially to clinical personnel, because they don't necessarily always see the interconnectivity of devices. For example, a biomedical device that now has a SaaS attached to it that allows a physician to view a monitor in their office, so that they don't necessarily have to go bedside to go look at the monitor to get the reports, etc. Sounds great. It's going to save physician a number of time, effort, etc. But how is that actually set up? How is that actually secured? How is the code developed? So some of those basic fundamentals of vendor risk management, just making sure that you're having those assessments completed before you bring these devices into your environment, into your clinics, into your departments, etc.
Yeah, and I think sometimes it feels like we're working really hard, and we're working really hard right now for the new things, right? To make, one of my pet peeves is that I believe that we as healthcare organizations, and some of my colleagues in the US feel the same. We need to be holding these vendors accountable for, right? They chose to use the cheaper way, etc. And now they're sort of downloading that risk to us. So needing to hold them responsible is and it is happening. But I noticed there was a couple of questions around why aren't these things being fixed? What needs to be done? Regulations, etc. So there is a lot happening, and these devices are vulnerable, but almost all health organizations are doing all kinds of things to protect them. It's not that we're not aware of it, or they're not aware of it. So don't be worrying that these things are out there, able to be hacked right away, because all health organizations have a lot of protections in place. We just want it to not be quite so cumbersome, time-consuming, costly, and impacting the clinical workflow. Dinushka, is there anything you wanted to add on either, some of the ways to protect biomed devices, or even, any of the stuff that we've talked about?
Yeah, actually, I did want to go back to Momna's point on education and awareness. I think that's huge, especially when we consider who is working with these devices, especially on a daily basis, right? And considering that they do have sensitive information a lot of the time, I truly believe that we could better secure ourselves when we have a security focused mindset. And that doesn't come naturally all the time, but we can encourage that through training and awareness, having regularly scheduled training sessions or information sessions, on threats that we may see even in our emails, or that we might witness or experience in our day-to-day lives, like when we're dealing with these devices, and what we can look out for, how we can protect ourselves. And if we do end up in a situation where we think, hey, this might be a targeted attack, this might be a phishing attempt, what to do next, what are our next steps? And always, if you suspect something doesn't look right, we can always look into it, always report. I'd rather be safe than sorry. And I think that's usually what I go for. And I think we as humans can be, a great weakness, but we can be our biggest defense when it comes to especially social engineering attacks. So I thought that was something important that we could touch on, and that's on every level, not just the physician level, but from the CEO to the physicians to the development team. I think it's really important to have security at the back of your mind for every single one of these steps.
Well, and in things like procurement, and that have it in the front of your mind, right?
Yeah.
Yeah. One of the it's when I started at Fraser, one of the first things that I did was connect in with the biomed teams, and they're very technical professionals, right? And they know their stuff. Like some of them, one was saying, he started when things were electronic. Right. He remembers holding two wires together under an operating table so that the physician could finish their work because some device needed, and now we're asking these people to all of a sudden become computer programmers and, and that kind of thing. So I think that's an area where I found directing some education was great, because they didn't necessarily understand the need and the importance. So helping them to understand this is why we need to do it, changing passwords, not wandering around with random USBs, once they, and well, to both of your points, once people understand the potential impact, they're still not always happy about it, but they're usually willing to cooperate. And one thing that I also found in healthcare was that, these days I do a certain amount of work with financial services, and, financial services, aircraft, airlines, we want their security to be top number, 5 out of 5. Healthcare is never going to get there, because there's always the friction between, the work we need to do and the work that of the people who are out there saving lives. My favorite line is from the title of something: "Dear security, do you want my password or a dead patient?" Right. So in healthcare, that's kind of the play that's always there. So yes, we're keeping these legacy devices around because we need them. We don't have money for new devices, and we're just going to have to do what we need to do. But it's better to have these devices with a risk than to not have the devices, the devices at all. So, either Momna, Dinushka, do either of you have any comments around things like what's coming out now with the SBOMs for these medical devices? Any thoughts or comments on that? Either of you?
I can jump in. So I think it's great progress. I think from a healthcare perspective, it's not anywhere near the other industries. Again, you touched on the financial sector as well. The thing is, they're heavily regulated from a security perspective as well, right? So that is why they are mature. Healthcare, yes, there are certain laws and regulations and requirements, at least from a Canadian or Ontario perspective. So there is progress being made, but we are miles behind, I would say. So that isn't to say that we should be waiting for laws and regulations to come out to act on some of these requirements. I think it's just bringing that awareness and really focusing your efforts and honing in. So when it comes to that training and awareness, so guess what? If someone does throw that dead patient line to me, these fusion pumps, for example, that will cause a dead patient. So it's just catering your advice and catering it to the audience, right? To making them understand that, hey, if this pump stops working, your patient will die because it's now connected to this AI software or this SaaS service or whatever the situation may be. So I think that awareness and training is a huge component. And I know security folks do get a bad rap because we're all like, hey, you can't do that. That's not secure. We don't necessarily do a great job in explaining the why and why it, in the sense that they would understand. So whether you're a clinician or whether you're a biomedical tech or you're, working in IT, it just really making them understand of why security requirements are important in terminology and in ways that they would understand and appreciate the importance of it.
Mm-hmm.
I would add that for what we can do better.
Yeah. Understanding all of these, it's good. And again, I'm the first one about, education. It's the best way to kind of bring people along on the journey. But there's still going to be problems. There's still going to, it's they're in there and they're going to keep being in there. Dinushka, did you want to, you guys are doing some things with sort of a bit more about the real-time monitoring of devices. Do you want to just share a little bit more about that? Because I think we said a lot of scary things about the biomed devices. It'd be good to hear a bit about some of the things that are working hard to protect everything.
Yeah, of course. So I think, it doesn't have to be so scary, and we do have help. I think that's something that, we can be positive about and feel a bit of relief. It's just to make sure that we have security in mind. But with the real-time monitoring that I was talking about earlier, even when I started, and I continue to learn every single day, but with tools like those, it's really useful, especially when we do have AI included, to have a bit of, bit more of assistance, I guess, in terms of incident response, especially when we do have an alert and we see it. Maybe it's something new that we haven't necessarily seen before, but you can get help from the AI tools that are integrated in the real-time monitoring, and they can sort of guide you onto, okay, what can I do here? What should I do? What are my next steps? Especially if you're lost and you don't really know what you're looking at sometimes. Security, I know not everyone is a security specialist, and that's completely fine. But these tools, especially again, when AI is integrated, can help us to get that background information that we're looking for to start the response, to start the next steps. How can we protect ourselves, and who should we reach out to? What should our next steps be? So
because
I hope that helps.
Yeah, no, they will do what a security analyst sort of used to do and correlate all the different pieces of information. And again, my hats off to all the incident response analysts, and they're they work very, very quickly. But and again, I'm a bit of an AI curmudgeon. But in that kind of a situation where they're essentially your assistant, go gather all this. I need all this information so that we can then kind of make that, in, like you said, depending on your tolerance, perhaps automatically dismiss it as a false positive, but at the very least, gather all the information. So when you, as the person trying to understand what's going on, you don't have to go or build these complicated rule-based systems to gather the information, because you don't necessarily need it all. Then you get kind of overwhelmed. So, yeah. So, was there anything else because we had a couple of questions, but I hope we've sort of answered them kind of as we're going along here. I'll give Momna and Dinushka a chance to just maybe a couple of words about maybe just something that you want our audience to take away.
I actually just wanted to touch on one of the questions that touched on why our legacy system still allowed. I know we talked about it, and how government intervention could maybe help drive some of the changes. Not to touch on political aspects, but the whole Buy Canadian movement is a great way for us to, pool our resources together. So thinking about traditionally how even at the provincial level, healthcare system has typically been siloed, and we've made great progress over the last few years in solidifying and unifying our approach when it comes to procuring systems. So that's a great way where we can certainly influence, right? One hospital organization buying a number of devices versus 20 hospitals buying the same devices. So using that whole concept of volume purchasing to influence some of these vendors that, hey, we're going to purchase your device if you meet our security requirements. And then just keeping a pulse on some of the breaches like that have happened in healthcare devices in the more recent years. So just using those as examples to have those procurement discussions, and that negotiation aspect, that security controls can very much be part of that discussion as well.
Yeah. All right. And Dinushka, any last? We got 2 minutes left.
Yeah, I know we went over a lot, but I just wanted to say, a lot of this might have been scary or, new, but it doesn't have to stay new. And security, even for the most experienced specialist engineer development team, can be a continuous learning process. We're all here to work together, and that's how it should be. So as long as we're all working towards security as the end goal, we can get there. It's just a matter of wanting to and effort. So it's possible.
It is, and people are dedicating their lives to this. People are, when people understand the enormity of it, they are trying to change. And again, we could talk for another whole hour on some of the other good things and concerning things, but mostly just want to say, any of you, for me, and I'm sure I speak for I am speaking for Momna and Dinushka, but reach out to us independently if you have any concerns, want to learn more. It's an area that we need more people to specialize in. So, all right, I think we're good. Thank you for spending some time with us and learning about something that the three of us are rather passionate about. And like I said, reach out to us anytime. Okay. Thank you.
Thank you.